Hi everyone, welcome back to iMumz Ask Me Anything session. So today we have an important topic, right? Like for many pregnant women, we are constantly thinking, how can I not have gestational diabetes? Like how can I prevent it? So that's what me and Dr. Triveni, when we were discussing the topic, we decided, this was the topic of the hour and we should be addressing it. So we have Dr. Triveni, who is a consultant gynecologist from Andhra Pradesh. She is published so many papers, done so much research on this whole aspect. So she would definitely like to share her insights with you as to how, as a pregnant lady, you can avoid gestational diabetes. Over to you, ma'am.
Okay, now I am talking about gestational diabetic mellitus. Okay, the thing is first you have to know what is GDM. Okay, gestational diabetic mellitus. The short form is GDM. It's a carbohydrate intolerance of varying severity first time detected during pregnancy. Okay, that means you can understand by definition itself. It's just a metabolic disorder. It's not nothing a disease. Because of pregnancy, there will be so many hormones imbalances. There could be placenta secrete hormones, even pregnancy related hormones. All these hormones, what will happen? The metabolism gets altered. So, whoever is prone risk factors, all this metabolism will be altered. So, there will be a little this carbohydrate intolerance. Carbohydrate is whatever the food you will be taking, there will be intolerance. Because of this, there
Uh,
is a slight.
I'm sorry to
Hello.
disturb. Actually, the
Okay.
users are saying that your voice is a little disturbed. Would you like to bring it a little closer to you?
Now is it okay?
Yes, now I think this is better.
Now you can hear it. No problem.
Yeah.
Okay. Okay. It's like an it's like a for intolerance during pregnancy. So the thing is how to prevent it. That is our main topic today. Then first thing is who are it prone for GDM. Then we will screen all of them. Who are it prone is like all the pregnant women I told it's like an hormones will be increasing, hormones will be all are prone generally. Then ethnicity, generally Indian population, all the studies shows Indian population itself is a high risk factor. Then who are the family history, obesity, who are the previous PCOS, all these are generally have the high risk factors for the GDM. Then actually whatever in India what we are following is generally we are screening everyone. It is known as the universal screening for GDM. Okay. Then the next point, whom we screen we talked about. Then when to screen is the important thing. When to screen is generally whatever the recommendations are, Foxy recommendations. What we are doing is initially at 12 weeks, that is in the first 3 months. Next, in the next trimester, 22 to 24 weeks. In the third trimester, 32 to 34 weeks. In the fourth trimester, 32 to 34 weeks. In the fifth trimester, 36 to 34 weeks. In the sixth trimester, 38 to 34 weeks. Why three times we are doing it again? As a we keep on changing, so they are keep on the prone for the GDM. Then at 22 weeks, at 32 to 34 weeks, we are repeating. If all the glucose levels are normal, then we will consider them as a low risk, then not GDM. If anything in that high sugar level, then we will treat them as GDM. Then the next point, how to screen them. Okay. Now, how to screen them is irrespective of their meal status. Some people know pregnant people, they will come, they will eat and come. We can't tell to fast and come pregnant people. So whatever the irrespective of whatever they had food and all, after coming to our clinic, generally you'll ask them to drink that 75 to 200 ml of water. They will drink it after 2 hours. We will generally check the sugar levels. If it's less than 140, they're unlikely. They're considered low risk for GDM. They are not the GDM. If it's more than 140 only, they are considered as GDM. Okay. Now they come more than 140 the first. Then what we have to do? Generally, uh, we have to check whether the sugar levels are prior 3 months before hemoglobin. If it's less than 6, it's not no need to worry much. If it's more than 6 and all, again we'll follow them up. Okay, how to keep them and all. In the second and third trimester, after 12 weeks also, again we'll ask them to do the fasting and postprandial sugars. If the fasting is below in 80 to 90 to 1, okay. If it's they are slightly higher up, if it's more than all this 90 or 120, to keep them up, just what medical nutritional therapy plus diet. Okay, if they're not controlling with with the diet and exercise also, next thing is what we will tell them is suggest the insulin, whatever the therapy based on the main, our basic aim is to put the sugars in normal such that the baby should not have any complications, mother should have not the complications. That is our main motto during pregnancy, that is GDM. Nothing GDM itself, as I already told, it's not a disease, it's just a metabolic disorder. So as it is a metabolic disorder, just we have to screen them. If it's more, just we have to put that metabolic disorder in correct thing. That is, we have to put the sugars in the correct values. That is, fasting in 80 to 90. More is we have to keep them in control, such that they won't develop any complications. Generally, what will happen if they are not in control?
Ma'am, I think there's a little disturbance in the network.
What? Okay.
Your video
Still
is
you can't
breaking.
hear.
Your video is breaking actually.
Video is okay. Okay.
Yes.
Fine here. Okay.
Yes.
Okay.
Okay.
Voice is fine.
Yeah, voice. Yes, you can keep that speaker near. Yes, mic. I think it's okay now.
Okay. 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 Then, as I already told, what are the complications? If the sugars are altered, if it's like higher end, what higher end of the sugars are like the fluid around the tritic cardiac anomalies. Prevent, just we have to keep the sugars in the normalcy. Okay. Then some people know, now the most common thing, all so many patients are coming to our clinic, they want to plan the pregnancy, prior to planning of the pregnancy, what all they can screen for, whether they can develop GDM or hypertension, what all the complications can plan. That time what we can do, that time who are the high risk factors, like family history of diabetic, some people will have obesity, some people have PCOS. Nowadays it's a rampant, PCOS is also. All these patients, what we can do is we are doing the OGTT. If OGTT or any altered, we are prior HbA1c we are doing. With this, maintaining the sugars like HbA1c less than 6, they can like become the pregnant without any complications, smoothly, without any anomalies, and all pregnancy is smoothly running nowadays. And if there is so much of obese, BMI is like more than 30 and all, we are asking them to reduce the weight, then they can become the pregnant. All these are like the preventive factors. If they are prior to pregnancy, these are the things. If they become pregnant also, not an issue. We have to keep screening and we have to monitor your sugar levels, and just we have to keep in track to prevent the complications. Okay. Then other doubt is whether this gestational diabetes is only uh, limited to the gestational pregnancy itself, or post pregnancy also can I have this diabetes. Okay. Generally this gestational diabetes, generally after delivery all our sugar levels will be normal. Whoever we will seeing the patient, whoever on insulin also, post delivery they won't require much of insulin and all. Okay. Generally it will become the normal. Again, to confirm it's just a gestational diabetes, after 6 weeks you can go ahead OGTT, glucose tolerance. If it's normal, you can take mellitus. Can we go into the questions?
Sure, ma'am. Sure. Going through the questions now. Actually, there was a lot of internet disturbance. So
Okay, okay.
yeah. Chaitra is asking, does eating mangoes on a daily basis lead to gestational diabetes?
Hello.
Can you hear me, ma'am?
Yeah.
Okay.
Okay,
So
Chaitra.
yeah.
Like say, if you are pregnant and if you were this one, all they were screening, they would have done whatever I told. If everything is normal, eating mangoes itself won't make you too prone for GDM. Okay, there are so many risk factors. Generally, there will be the genetic risk factors. All will be. Once we are challenging with glucose challenge test, and if it's normal, 12 weeks, 22 to 24 weeks, if everything is normal, then they won't, you are not prone for GDM. Okay. Yeah. Eating alone mangoes won't prone you. You can enjoy your pregnancy. You can eat mangoes and aram se, if all your sugar levels are normal, what I told, the guidelines, if it's normal, you can aram se enjoy your pregnancy by eating mangoes.
Thank you, ma'am. Ma'am, the next question here, Priyanka says, as my doctor said, I have placenta previa. I just want to ask if I should walk or do we need complete rest?
Okay. How many weeks right now she is?
She's 27 weeks, ma'am.
Okay. Then it depends, like placenta previa, whether you need the rest and all depends upon type of placenta. Okay. If it's a slightly above the internal lock and she has like not the, at all the problem, she can do her routine household works and all. If she doesn't have prior bleeding PV, nothing, she can she can do her routine work. If it's like a complete placenta previa, which like which is completing the os and all, then she needs the rest. Okay. Again, your doctor will tell you based on the scan report, based on your gestational age and all. She would have put her on progesterones and all. Okay. All the placenta previous need not have the complete bed rest. It is individualized basically. It depends upon where is the placenta, exactly how many centimeters and all, and what is the cervical length, whether she has any other risk factors. All these are the individualized. Okay.
Thank you, ma'am. Next question I see here is do we have to cut down rice to avoid gestational diabetes? I have rice at least twice a day.
To avoid, like see, why we will tell rice to avoid is basically depend upon the glycemic index. Okay. It's like a high glycemic index. Whenever you eat the rice, it will generally fastly it will enters into the blood. So generally we'll tell by eating alone rice will not make you prone to develop the gestational diabetic mellitus. Okay. Whatever, like whatever I told, it depends upon so many factors. Uh, like your family history factors, your obesity factors, and you have any PCOS, prior PCOS. If you're screening, that's what I told is challenge test. The test itself, what when we are doing, we are giving the glucose and we are challenging the system post challenge 2 hours. If it's normal, means you are not prone to get the gestational diabetic mellitus. Then whatever you are eating by rice and all, it will not prone for the diabetic mellitus. Generally, whatever in pregnancy we will tell is whatever the calorie requirement you should take it. Don't eat rice too much. Like you can eat in the like two at least 3 hours, 3 hours small meals you can take it, and you can eat like a protein diet, high protein diet, vegetables, fiber, all the things which are needed. You can limit you can change the rice to into the chapati and all. What will happen is rice you will eat more, and it's a high glycemic index. Then so to convert it, we'll ask them to write 1 2 chapatis and rice, whatever it is. See, pregnancy itself, it's not this one. Whatever you are eating, just enjoy it. Unless you are normal, don't think much about it.
Thank you, ma'am. So, next question is Shweta. I'm 33 weeks and I have gestational diabetes. I am now on insulin morning and night. Also, taking glycomet SR 500. Does this affect my
Okay.
baby, or can it cause preterm delivery? Is her question.
Okay, okay. See, whatever the GDM I told, the only goal is keep your sugars under control. If it's your fasting is like 80 to 90 and your after food 2 hours, if it's a tight control 110 to 120, max 130, then there will be no issue at all. Okay, if your sugars are normal, complications will be very less. At the next, your doubt is whether taking the insulin causes you preterm. See, insulin is a very safe during pregnancy. All the studies are telling the same. Insulin keep your sugars in control. Like fasting and post pregnancy, all the studies are telling the same. Insulin keep your sugars in control. Like fasting and postprandial is by water, by insulin and the oral hypoglycemic agents, whatever you are taking, then I don't think so. If all the sugars are in control, there is less chances to get the preterm delivery.
Uh, Thank you, ma'am. So next, Sindhu is saying, I'm in my 25th week of pregnancy with high GTT values. I have brought it under control with diet, but occasionally it spikes, in the past as high as 180. Will those
Okay.
spikes have an impact on the baby? Can I
Okay.
continue with the high protein diet, or do I need medication?
See, generally, after, as you told, after GTT or telling that is a high sugars levels, generally we will monitor every 15 days, depends upon the situation. If every 15 days, if the fasting and postprandial sugars are within the normal, how we are maintaining? By diet and the minimal exercise. Diet is also what is the GDM diet, we will tell is split meals. Okay, whatever you are eating. Morning, if your breakfast is like some 3 dosa, we will ask you to take at 8 o'clock with 2 dosas, and again what 10, 11 o'clock, again 1 dosa or 2 biscuits, like that. Don't eat too much at a time. Okay, that's the basically split meals. Whatever you are eating you are eating in the split manner. Whatever the breakfast, you will eat at 8 and 10 o'clock. Whatever the lunch, you will eat at 1 o'clock and 3 o'clock. Again, the mid snacks and the night. So we are maintaining the glucose whole day at at the same level, such that because whatever you are growing inside the baby also should require the calories. So you can't fast too much, you can't you can't do dieting also. Okay, whatever body needs the food. So you have to take, okay, by diet, whatever, like I told, no, this is known as a medical nutritional therapy. With diet and exercise, every 15 days, if it's a fasting and postprandial is maintaining, then you need not to take any medication. If it's any altered, you can go to the doctor and they will monitor you. If any high sugar level, then how much, whether oral medications required or insulin required to maintain, they will do it. Okay.
Thank you, ma'am. Shweta, I see your question, but it is a little unclear. I also want to
Okay.
know, will wheat, rice, and jaggery help in reducing sugar level? Uh, I I think she means by cutting off wheat, rice, and jaggery, will it help in reducing sugar level? She is in 33 weeks. So, do you think that should help?
Already she okay. Already she is a diabetic patient.
She has not mentioned that, ma'am.
Okay, okay. As I told, like the normal patient, there is no limit. Like, see, it's like already told, we are challenging the system. If it's normal, no, just enjoy your pregnancy, enjoy whatever you are eating. Many calories you have to restrict. Just enjoy it. Okay. No limit of sweets and like and all. If you are diabetic, then you have to maintain the sugar levels. Okay. If you have to maintain the sugar levels, I already told, just prevent to have over high glycemic foods like jaggery, rice, and all. Okay. Don't try to starve in pregnancy. Just limit your high glycemic food, such that immediately whatever you eat, they will spike the sugar level. So what we are telling is low glycemic food, like wheat, vegetables, okay. And you can eat the rice also like in a split manner. You can eat chapati also, two chapati at 1 o'clock, and you can eat the other chapati at 3 o'clock. Don't try to starve in pregnancy. Eat, but in the split wise manner, and maintain your sugar levels. Okay.
Thank you, ma'am. Ma'am, Kavya is asking, my husband is a diabetic. In his family, there are many people diabetic. My parents are not diabetic. Will my
Okay.
husband's
Okay.
diabetes impact my baby? If yes, how to prevent?
Okay. First of all, your husband's history won't come to you, like your baby and all. So, as I told, pregnant women, because pregnancy itself is a risk factor, generally we are screening everyone. Okay. So, generally we are screening everyone, and we can screen you at first 3 months, second 3 months, and last 3 months. If it's normal, nothing will impact you, and your husband's family history won't impact you. If your parents and if you are obese and if you have any PCOS history, that will have the maybe the risk factor for you to get the GDM. Okay.
Thank you, ma'am. The next question I see here is from Chaitra. So now,
Okay, Chetra.
in the same category, my father-in-law is diabetic. Will that affect my
Okay.
pregnancy? I don't think so, right?
Yeah, yeah. No, no, no. As I already told, only your weight, all your PCOS itself is this one. And as I already told, all Indians and all the pregnant women are at risk. And generally, we will screen whoever are the pregnant women to the OP clinic. Okay.
Thank you,
Don't
ma'am.
think about much.
Meghna is asking, my fasting sugar is 89.3 and my post sugar is 123.5. Do I have
Okay.
gestational diabetes? This test was done at 20th week and I am 24 weeks right now.
Okay, whatever you are telling is in the normal level, slightly normal level. Just next time you can go for this OGCT, like oral glucose challenge test, or OGTT, oral glucose tolerance test. Okay, the oral glucose tolerance test also generally you will do at fasting after 75 gram glucose 1 hour to at second hour we will do the oral glucose challenge test. And if all the values are normal, then you don't have to think much about it. Okay, next you can repeat the same thing at 32 to 34 weeks. If it's normal, Just leave it. You enjoy your pregnancy.
Thank you, ma'am. Ma'am, the next question I see here is Prachi. I think she would have joined a little late, and that time the network was also disturbed. She's asking what is
Oh,
the
okay.
normal range for fasting sugar pre and post, yeah, fasting sugar and post meal sugar, and also BP at 21 weeks.
Whether she is already diagnosed as gestational diabetic or she is
No,
normal.
she just wants your information.
Okay, she's just routine antenatal, like routine pregnant patient. Yeah.
Correct.
Okay, okay. See, as I already told, if you are routine pregnant, generally they will first, whether you are prone to have high sugars, generally they will screen you, the screened at 12 weeks. Again, they will screen you at 22 to 24 weeks. Okay. Again, if this is also normal, again we will repeat at 32 to 34 weeks. As I already told, as pregnancy goes on, there is little chance hormones will change. There is a little chance of getting risk of getting the gestational diabetes. So they will screen at each and every point. At all the points, if you are challenging the system by giving the glucose also, if your sugars are maintained normal, then you need not to worry much. You consider it as a normal. Okay. And coming to the BP recordings, generally during pregnancy, we will see some people will have at 100, 60, 90 to 100 with good pulse volume and all. Okay. And if you want like a hypertensive, no, like generally we will tell more than 140, 90, we will consider it as an hypertensive in pregnancy. Then we will follow it up.
Thank you, ma'am. Uh, the next question is from Sonali. I was detected with high
Okay.
diabetes. My HbA1C was 11.4 1.5 months before pregnancy. I was on Novomix 50, and then my HbA1C was 7.4. After detection of pregnancy, I started with uh, Humlog
Okay.
3 times, and Lantus at night
Humalog.
insulin.
Okay.
Yeah. Is it safe to take Lantus in pregnancy?
And now she is on what all? Humalog and
And Lantus.
okay, she is on both Humalog and Lantus. Correct?
That's right, ma'am. That's right.
Okay, okay. Whatever she did was the right thing. The pre-pregnancy itself, she undergone the like she is pre-diabetic. So by controlling the this one, she became the pregnant. Whatever I told, less than 6 is the ideal thing. Okay. Already it's a 7.4 and she is taking the insulin. As I already told, all insulins are safe during pregnancy as far as considered. The main aim is maintaining the sugar levels is the most important. Whatever insulin, whatever the thing is, the basic motto is the maintaining the sugar levels. Whatever the Lanta she is telling is, it's a long acting and Himlok is short acting. So to maintain the all the and whatever the short after food to control that sugar, they are giving the Humalog. So with all these things, if she maintaining all the sugars like fasting less than 90 and postprandial less than 120, minimum 130, all the whatever the complications, she can be reduced. And whatever she has to get it done is, she has to get the fetal echo. Whatever the GDM patients, what we will tell is to get a fetal echo at 4 weeks. Okay. Taking insulin, she won't have any risk factor. The only risk factor is if your sugar levels are not maintained properly. If your sugar levels are maintained with whatever insulin, I don't think so, not a much problem. Okay.
Thank you, ma'am. Mansa is saying, hi, ma'am. I'm COVID positive. My doctor suggested steroids, Medrol 4 mg, around 50 tablets. Now, after
Okay.
using this tablet, my sugar level increased. I'm not a diabetic. Will this steroid increase sugar?
Yeah, generally, steroids increases the sugar, and you didn't mention what are the what and postprandial done. Okay, if fasting and postprandial after 15 days after the stopping steroids, even during the steroids, you check your sugar levels. If it's high, then based on the sugar levels, you can take the treatment. And after stopping, also 14 days after, you can get the fasting and postprandial done. If it's normal, no need to worry. If it's high, then based on that, we can treat it and we can follow it up. Okay. Generally, steroids increases the sugar levels. That's not a worry at all. But what is the sugar levels is important, and how much treatment is required for the sugar levels is important. Monitoring sugar during hello.
Ma'am, hello. Yes. Ma'am, there's a lag actually. There is, I think, some network issue.
Okay.
Is it possible
Okay.
for you to connect to a Wi-Fi?
It's a Wi-Fi only. It's Wi-Fi only.
Oh,
Wait, I will
okay.
convert to my.
Sure. Once, let's try mobile data. Let's see if that works.
That's what. Uh, Hello.
Hello? Yes.
Okay.
You can hear me?
Yeah, I can hear you.
I think it is not breaking now. Great. So Priya
Okay,
is
okay.
asking, hello ma'am, I'm 29 weeks. I got OGCT as 157. So I stopped
Okay.
rice for all three meals and started chapati for breakfast, lunch, and dinner. Will it harm my
Okay.
baby or will I have to go for preterm delivery? I have a cervical stitch as well, so I can't do much
Okay.
exercise. What do you
Okay.
suggest? Like, what exercise can I do for a normal and 40 weeks delivery? Yeah.
Okay. See, already you have cervical stitch, right? As I told, whatever is the final thing is mixed foods. Okay, eating chapati won't harm your baby. As I told, like 40 overload at once. The because you are you will split and eat. 8 o'clock, 10 o'clock, 12 o'clock, 3 o'clock, 7 o'clock, and 9 o'clock. Okay,
Uh, Ma'am,
and
no, it is breaking more actually. I think we can go back to Wi-Fi.
okay. Minutes.
So sorry everyone for the inconvenience. Uh, Please continue, ma'am. Hello. Uh, Ma'am, we cannot hear you. I think there is some disturbance. Okay. Uh, okay. Yes, ma'am.
Okay.
Continue, please. Yeah.
Ah, okay. The thing is, I you told like you had already underwent a cervical stitch. Length. Generally the short cervix they would have put you a stitch and all. There are so many factors. Generally with cervical stitch we will advise you to take the rest and all. Not much exercise. By diet alone, whatever as I told, split meals, monitor by monitoring your regular sugars and all, you can continue your pregnancy. If you are monitoring your good sugars and all, there is no much of like liquor won't increase. Hello.
Hello.
So
Yes, ma'am.
you can hear,
Yes.
right, without disturbance.
Ma'am, actually, there's a lot of
So
disturbance. So we might have to close the session early. Like we are not able to understand anything.
okay, okay.
Huh? So we'll probably try it again next time. To all the
Yeah,
users,
sure.
we really apologize for this inconvenience. We are facing some technical issues. All the questions you would have posted, please post it back in the feed section. And one of our doctors will revert to you within the next 24 hours. And we are extremely sorry for this inconvenience. I think it will be better in the next session. Thank you and have a great evening, everyone.